IMPART stands for Intersections of Mental Health Perspectives in Addictions Research Training, and it's a government-funded program that is intended to enhance addictions research in Canada, primarily by bringing together individuals from diverse research backgrounds, as well as across sectors, to address the issue of addiction in a more holistic and complex way. We train our fellows in sex and gender analysis. We also look at the issue of addiction in relation to other issues that shape addiction. So for example, trauma, violence and mental health. And we approach the training and the issue of addiction from a transdisciplinary perspective.
One of our strong interests has always been on gender, women and addiction. If you bring sex and gender considerations into research design and treatment and policy, it's going to actually personalize and recognize all genders.
I've always accounted for mostly sex differences in my research, but IMPART has really opened my eyes to considering gender differences.
The more and more I studied about the emergence of addiction, I started to understand how closely intertwined it is with mental health.
And that's been the challenge, I think, for us to deeply understand how trauma and substance use are connected.
The IMPART program will have existed for about 12 years, so more than a decade of doing this kind of work.
Addiction is such a complex disorder, and it involves genetics, environment, biology, neurobiology, stress, early life experience. It became very clear that you can't even begin to work on this problem unless you have a transdisciplinary perspective.
You know, I think it's such a wonderful experience to be part of IMPART and so very important for how our research looks about addiction.
One of the things that's been great about IMPART, it's provided a forum for people from very different disciplines and perspectives to come together.
That idea of sex and gender-based analysis, integration of trauma and other linked issues, and transdisciplinarity, it's not a matter of how they will help, it's a matter that they're just essential.